Hello and welcome to the YouTube channel Doctor's Anatomy. Today we have with us the X-ray of abdomen, and we are going to look at the X-ray of abdomen with its clinical significance. So the first thing that you can notice over here that you can visualize the certain bony structures that is present over here. This part over here, this is your pelvic bone over here. This structure over here, this is nothing but your sacrum. This area is known as an sacrum. These are your lumbar vertebrae, so you can count L1, L2, L3, L4 and L5. So these are your lumbar vertebrae. You can also notice T12, T11 and T10 vertebra over here. Along with that, you can also notice the ribs are present over here. The ribs, these are the 12th ribs, this is the 11th, this is the 10th rib. So these are the structures, bony structures that you can visualize over here. So this is where the kidney is located over here. This is the left kidney. Over here, this area, this is known as an hilum of the kidney, from where the renal artery, renal vein and the ureter is getting entered and getting exit from this area of the kidney. So I can say that this is how the ureter is extending. This is how the ureter is extending into the inferior aspect of the abdomen. Over here, it is going to fuse with the urinary bladder. This is where the urinary bladder is located. You can see that the earlier part of the ureter, where you can see it is getting dilated up to the lower pole of the kidney. This ureter is getting dilated, so we call this as the renal pelvis. Below the lower pole, the ureter shows the constriction, and this is known as an ureter proper. This is the renal pelvis, and this is the fusion point of the renal pelvis and ureter proper, where you can see the ureter is getting constricted. So this area, generally you will find this terminology in the CT abdomen, where you can see that we call this area as the PUJ. The P stand for the renal pelvis, U stand for the ureter proper. So this is the junction between the renal pelvis and ureter proper. Then another constriction you can notice is at the level of its fusion with the urinary bladder. So around here, where the terminology that you will come across is the VUJ. So V stand for the vesicle. The vesicle is nothing but the urinary bladder. U stand for the ureter proper and J stand for the junction. So this is the two terminology you can come across when you are looking at the CT of the abdomen. Generally, you will find that the stone get trapped at the PUJ and at the VUJ level. Okay. In this case, you can notice that there is a white marked area is present at the junction of the ureter proper with the urinary bladder. If I'll zoom in the structure, you can notice that white patch is, you can notice over here, and this is the stone. You can say that in this case the stone is getting trapped at the VUJ. So again, V stand for the vesicle, U stand for the ureter proper and J stand for the junction. This is the two most likely area where the stone can get trapped, because the diameter of the ureter is getting narrower at the level of PUJ and VUJ. So that is what you need to remember whenever you are looking at the X-ray of abdomen. You can notice the stone is present within these two areas. It can be present anywhere, but most frequently it can get trapped in the VUJ or it can trapped into the PUJ. So again, I'll show you the stone location over here. This is again your kidney. This is how it is descending downward. So up to pelvis, up to here we call this as the renal pelvis. From here to here, after the lower pole of the kidney, we call this as the ureter proper. and you can notice that this is where it is going to fuse with the urinary bladder over here, and where you will see this area over here, this is known as an VUJ. Okay, and you can see that stone is getting trapped at the VUJ junction. You can see the stone is there. So that is how you are going to look at the X-ray abdomen to find out the stone that can be present within the X-ray.